Hi, I'm Dr. Anindita. And if you ask about hair concerns and what is the commonest hair concerns that we see in our practice, I would just not even take a moment to say that it is dandruff.
So, what are the common causes of hair loss?
Hi, I'm Dr. Anindita. And if you ask about hair concerns and what is the commonest hair concerns that we see in our practice, I would just not even take a moment to say that it is dandruff. In my practice, dandruff has been the commonest concern. A lot of people coming to me with concerns of flaky, itchy scalp, and a lot of them saying yes on incidental questioning when they have acne or they have other body acne eruptions concerns. And if you ask them, do you have dandruff? They'll definitely say, yes, doctor, that's another thing we wanted to talk to you about, that we do have dandruff. So, dandruff being so common, I'm sure there is something that we can do to prevent it. And why is it so common and why does it happen? And what is dandruff? There is a lot of questions. Dandruff is a fungus, dandruff is an infection, but dandruff is neither. Yes, it can be triggered by an yeast, a kind of fungus that is naturally present in the scalp and the skin, but dandruff is basically the white, flaky scales that we see on our scalp. Some of them dry, small scales that just fall off during combing, or they just kind of come up on the surface when we mildly itch or scratch the scalp. And some of it are the wet, sticky, big plaque kind of thing, which is sticking to the scalp, and if you try to take them off, they sort of bleed or leave the skin red. How do we know what is mild dandruff, what is moderate dandruff, what is severe dandruff? So mild dandruff, which is the small white scales that come off, which just flake off naturally, can be treated by mild shampoos. We did not use anti-dandruff shampoos, and if these scales go off with frequent cleansing, it is no more a concern. However, several kinds of the scaling do need to be treated by medicated shampoos, specifically containing ingredients like ketoconazole, zinc pyrithione, cycloperoxamine, selenium sulfide, a lot of others which actually help to reduce the buildup, which help to reduce the infections or the injured skin on the scalp and keep the scalp clean. So dandruff is extremely common because in a tropical country like ours, there's generally a lot of moisture in the air, which makes the yeast, the naturally occurring yeast or the fungus in our body and scalp called Malassezia, very powerful. It feeds off the oil, and humid weather makes it more powerful. And hot water, moisture, excessive shampooing, all these things can actually imbalance the scalp status and create these little dry flakes. Another reason why dandruff seems to be a recurrent problem in a lot of people is somehow people don't seem to be using the shampoos in the correct way. So the correct way to use an anti-dandruff shampoo is on the scalp. Once you rinse your hair, you need to leave it on for about 3 to 5 minutes and gently massage the scalp with your fingertips. So this contact time is extremely important for the key ingredient to work and neutralize the effects of the fungus. So once you do it for 3 to 4 minutes, and this process may need to be repeated 2 to 3 times a week. So the shampoo is to be left on the scalp. There is no need to shampoo the rest of the hair with this. People can use a normal regular mind shampoo for cleansing the scalp. And as for the complaints that anti-dandruff shampoos make the scalp drier or make the hair rougher, it can be true to a large extent, but it can be neutralized by using a good conditioner on the length or the shaft of the hair. Some of the popular and effective anti-dandruff shampoos available are the Scalp Plus, the Elegance shampoo, the Nizoral shampoo, Caraglow AD, the Sebamed anti-dandruff shampoo, 8X. They are very potent, very effective, and they're generally extremely effective in controlling the dandruff. However, if any of you find any rashes, itching or burning after using these products, please stop it and have a consultation with your nearest expert to understand the correct anti-dandruff product for your scalp.
So, what are the common causes of hair loss? typically, if we sort of start, the first one would be nutritional deficiency, low hemoglobin, low levels of vitamin D3, B12. Then there could be metabolic conditions like thyroid, polycystic ovarian condition, hyperandrogenism. There could be obviously the male pattern hair loss, where you're carrying the genes for early balding or early androgenic hair pattern. And then there are stress, there is improper diet. So all these things we have seen, and then there are seasonal changes. These are all the conditions that can lead to either an acute hair loss, and one of the biggest thing which I just forgot to mention earlier is a hormonal hair loss, especially after pregnancy, during the delivery, post delivery. Women notice a lot of hair fall because during pregnancy the hormones are very conducive to a good hair growth, and suddenly after pregnancy all these hormones go into the withdrawal phase, leading to a acute hair fall. Hair fall can also be a side effect of having some long-term medications. So most, when we are talking about hair fall, how to address hair fall conditions, we first of all have to identify which of these could be triggering hair fall in a particular person, and then the treatments become simpler. Hair fall can cause a lot of psychological and emotional disturbances in a person, because hair, as we all know, is the crowning glory. It really can make or break the way a person's appearance is. So it could be very demotivating to be continuously experiencing hair fall and not having a solution to it. So as I said, if we are able to identify that hair fall is being caused by a set of nutritional deficiencies, we should definitely check our blood parameters, and if we need to go onto the multivitamin supplements, at least covering for the D3, B12 and iron. In addition, we could have trace mineral deficiencies. There are lots of good hair supplements containing biotin, magnesium, selenium, and one can approach the dermatologist or a hair expert to find out which set of vitamins, whether it is a cyclical therapy, whether it is a same set of nutritional supplement that can help you tide over this crisis. A second thing to use would be peptide sprays. Sprays containing peptides like Redensil, Capexil, Anagen, Procapil, Bicapil. These have become very effective at strengthening the hair shaft and at improving the blood circulation and improving the hair follicles in general, leading to a hair growth which is more immune to these stresses and environmental damage. So, and peptides, the biggest plus point with peptides is that you never end up with rebound hair loss once you stop the peptides. So you can do it for a period of a few months, and if you feel you want to take a break in between, it will not really cause a reversible damage. So after hair supplements and peptides come your hair products that you're using. So one must take care to ensure that you're using gentle hair products, preferably sulfate free or paraben free or free from toxic chemicals. So the shampoo should be a gentle cleansing and conditioning in case your hair is dry. You should minimize the use of chemical treatments on the hair, especially things like straightening or with some things which interfere with the hair bond structure. And if there are seasonal changes, like you're going for a beach holiday or there are monsoons, it would be a wise decision to cover your hair with a loose bandana or a cotton scarf to prevent the environmental damage from affecting the cuticles of your hair. So we have made a playlist about hair care and hair supplements. Don't forget to subscribe to our channel and hit the like button to know more about this.